Hello and welcome. A very good evening to all of you. Thanks for joining us here on the Urban Debate, the weekend edition. I'm Afrida Rahman Ali. Well, one of the toughest decisions regarding the unlocking so far, viewers, have been with regards to the reopening of schools. We have already decided to open malls, theatres, restaurants, even gyms and swimming pools. So why should schools not reopen? What are the pitfalls in this area? What are the big concerns? That is something we are going to look into over the next half an hour. Many in the country believe that India is now in the cusp of a downtrend. This is the time we have to make sure that we don't lower our guards, we don't throw caution to the winds. This is a critical juncture that the country is in. Of course, we've crossed 70 lakh in terms of the number of cases, but then there is a very high recovery rate as well. There are many positive signs as well. Like I said, there is a need to exercise abundant caution. Often children are the toughest to rein in, and when we talk about schools, we are talking about children, we are not talking about adults. So different states have taken different positions in this regard. Maharashtra and Gujarat have announced that they will consider reopening schools after Diwali. Uttar Pradesh government has announced that schools for students will reopen for the 9th to 12th from the 19th of October, so only for high school students. Madhya Pradesh schools have partially opened for the higher classes from 9 to 12 since the 21st of September. Goa and Chhattisgarh government not taken any decisions. Many other states have not taken a clear decision in this regard. So to discuss on the issue of, okay, you may have SOP on paper, but will it be enforceable in schools? Do our schools have the wherewithal? Do they have the infrastructure, for instance, to have the security and safety features? This is a new normal that we are stepping into. All the COVID care norms will have to be in place, just like it is in many other countries that have decided in favor of opening schools. So joining me in this discussion, Dr. Tanmay Mahapatra, who's a doctor and epidemiologist. He's joining me from Patna in West Bengal. Gurumurthy Kasinathan, who's an academician and director of IT for Change, joining me this evening from Bengaluru. Dr. Samir Dalwai, developmental pediatrician and NCP spokesperson, joining me from Mumbai. Anubha Sahai, advocate and president of India White Parents Association. Thanks to all of you for joining me here on Urban Debate this weekend. I want to begin by asking you, Dr. Mahapatra, if I can begin with you, that the concern really is at this point about children is that they may not get infected, but children can be potential carriers. And therefore, therein lies the danger here that when you open out schools, are you in a way opening out channels for the infection to spread? Dr. Mahapatra.
Whenever we are talking about this unlocking in a country like India and we are dealing with this kind of scenarios, we are dealing with actually optimization. A country cannot go for lockdown for something more than few months or like that. And schools cannot be exceptions. When we are opening up malls, cinema halls, there also everyone is going, children are also going. And the point is, when we are keeping the schools closed, we are actually having a big problem regarding number one, the education part of it, number two, the mental status of those children, as well as different other kind of social and other environmental perspective in the familial environment. Now, when we are planning to open the schools, we definitely have to be careful about the fact that it's all about the system that we are dealing with. You rightly said that we are in a new normal. In this new normal, we are actually dealing with all the aspects being something different, like we are required to continue with the individual distancing and all other like behaviors. Now, when we are dealing with children, it's not that easy to have those things mandated, but we can always have, because discipline is something for which school is the place where things actually start practicing and getting those practice into the habit. Now, in different kind of scenario, we really don't know how long are we going to have this kind of situation. So for that, it is very much important. This is not always for the children at school. This kind of behavior needs to be inculcated. So I think schools should open with all kind of mandates, optimize that impact. And on the other hand, there is another point that
Okay.
children are
Right.
not going to be infected. That's the right aspect. Children may be infected, but their risk of the developing cytokine storm and other stuff may be little less or somewhat less than the adults. So the same kind of safety precautions and other things need to be there also. And whether they are going to be a carrier by going to the school doesn't matter, because anywhere when they are going, anyone can be a carrier. So ultimately the situation remains the same. Now when we are opening up restaurants, opening up malls, opening up markets and other
Okay.
stuff, we have to continue different kinds of safety precautions in this new normal. The personal hygiene and other processes need to be built into the behavioral system from child to adult, everyone. And our school system and our teachers need to be the actual office bearers to have this habit to be inculcated within the whole system even since childhood, because we really don't know how long we are going to have this. Right now we don't have any vaccine which are going to give us any kind of idea that within next 5 years there will be 0% chance of having corona or something. So this is very much required, the kind of picture you are right now showing. Different schools need to have all kinds of practices and precautions being embraced there. All schools are not going to have equal amount of infrastructural support and other stuff. So it has to be taken care in a holistic manner, that we are not dealing with only the upper part of the society. We have to be sure that we are dealing with all. So how we are going to ensure that even in the municipality schools or those schools panchayat level, we have to ensure that the whole health, the whole system, the education system and health system, to a convergence, talking more to each other, and by making a policy of incorporation of these factors into the infrastructural development system and ensuring the education and child growth monitoring also going on.
Right. I got your point, Dr. Mahapatra. Right. You seem to be saying that children are carriers anyway. Opening out schools does not make them any more or less of a carrier, if that is the concern. But I want to, before I go to the next guest, also the reason why I was asking that question is looking at the other countries, and we're running it in our graphics also, that countries like US, Israel and Germany have shown a spike after schools have reopened. So this is an important issue to discuss threadbare and understand the consequences. Before I go to my next guest, if I can just have those the graphics on screen where we are looking at the guidelines that the Home Ministry has issued. So take a look at this. Physical distancing of at least 6 feet to be followed, use of face covers and masks, frequent hand washing, which are of course the three basic things: hand hygiene, mask protection and distancing. Use of alcohol-based hand sanitizers being prescribed. Respiratory etiquette to be strictly followed. This involves strict practice of covering one's mouth and nose while coughing, sneezing with a handkerchief. Self-monitoring of health by all and reporting any illness at the earliest. Spitting shall be strictly prohibited, and installation of Arogya Setu app. Now my question is this enough? Gurumurthy Kasinathan, this is the broader guidelines, but you heard Dr. Mahapatra as well, and we all know that this is a virus that needs a live host, a human host, and children are equally vulnerable. What is your position on this matter as an academician? Where do you stand on whether schools should reopen or not?
Thank you for this opportunity. I quite agree with Dr. Mahapatra. Basically, if you quickly take a look at the economic lockdown that we had in March, we had an extremely severe, even harsh lockdown for quite some time. And then in hindsight, I think almost everybody agrees. I think this is important. Everybody agrees that the solution is not a complete lockdown where there will be no activity at all. And maybe now we are going to the other extreme where we allowed everything. One should question whether shopping malls have to be open 24/7, whether theaters have to be open. But we still feel that there is a need for economic activity to resume, because in the case of zero economic activity, the impact, the negative impact on the economy is very severe. The question is exactly the same even in the case of schools. Unfortunately, what we find is there is a very strong elitist or a middle class opinion, which is having a validity in its own way, but which is creating a fear psychosis that if you open schools, it's going to create a large kind of a spike. So I think the solution is not either you close schools entirely en masse or you open them entirely en masse. It's not, neither is a solution. States and even districts and maybe talukas have to take decisions on school opening.
Okay.
And the reason I'm saying that is very simple. Just like economic lockdown has an enormous cost in terms of jobs lost, income loss, poverty, etc., keeping these schools closed as an invisible cost which we are not willing to entertain. It doesn't affect the middle class because our children will be happily learning through online methods in their own education institutions. But 70% of the children of this country go to institutions which do not have that kind of infrastructure. And therefore, research says that already we are seeing the impact of extended school lockdown. Point one, child labor has increased. Children are being put into farms and workplaces when they were going to school earlier. Early marriages have increased. Girls are becoming more and more vulnerable. Earlier, the high school and the colleges of protection of against early marriage, and in the absence of that, we are seeing increasing early marriages. Apart from child marriage apart from early marriages and child labor, we are also seeing other serious issues like malnutrition. The midday meal scheme of the country is lauded all over the world as a very important nutrition supplement for children. In the absence of midday meals for months together, research says that the nutrition levels of our children, which were never great to begin with, India is one of the worst malnutrition rates in the whole world. Our children are suffering. And I think we have to open our eyes and see that while there are benefits in terms of avoiding deaths by keeping schools closed, you are allowing slow death of our children and their parents by keeping schools entirely closed. Therefore, I'm not advocating all schools should open and it should become business as usual. But certainly schools are to be opened in phased manner and with all the precautions. Why should we not have all those precautions implemented? It will be a question of political will. It's a question of putting resources into play. And I think we cannot let our children down any more than we have already let them down. And I think this is a very important thing that we have to look at the cost of the lockdown in terms of child labor, early marriage, malnutrition, apart from loss of learning, which everybody acknowledges is a very serious issue. And that's the reason why schools have to be open, but in a phased way, in a decentralized manner, with decisions of shutting down whenever required. So if there's a problem, there is a case, then you need to do all the things that you're doing in terms of locking down, creating containment zones within schools. But this complete shutdown of schools is a disaster, is what I would like to say.
Okay, so complete shutdown is not something that you advise, Mr. Kasinathan, raising important points about how individual talukas and states have to take these decisions, because it has to be decided probably at the micro level, and therefore the centre also has kept this open for the states to take the specific decision. Dr. Dalwai, if I may come to you on this, we just heard Mr. Kasinathan also there giving us a broader spectrum of the larger issues that come into play, whether it's the issue of malnutrition or for that matter the other social issues that are here in specific to a country like ours. And I also want you to weigh in on the issue about whether we should totally look at what is the children's preference. The children have got tired with their online learning, a digital fatigue has set in, and they want to go back to the classrooms. Dr. Dalwai.
So good evening. To me, there are two parts of this thing. One is what about the academics and education for children? Second is what is the health cost to children as well as society at a whole? Both of these things have to be seen as to each other. I do agree with Mr. Gurumurthy when he said that there are so many other disadvantages of schools being closed. But I'm not sure that there is any study which shows that child marriages have increased because of children not going to school vis-a-vis the entire economic impact on the people's minds. So I think we have to look at that in a larger perspective. Coming back to the topic, what I would like to address your topic is by understanding that there are two issues here. When do we reopen? How do we reopen? And how do we continue children's education as well as looking after their mental health while we are in a lockdown? I think when to reopen, the Indian Academy of Pediatrics that I am representing here, under its president, Dr. Bakul Parekh, Dr. Piyush Gupta, have come out with a fantastic document on this issue about reopening schools, when to reopen, how to reopen. And it's very clearly proven that the actual physical risk of illness to the children is much lesser than adults. However, children are known to be asymptomatic carriers as much as the adults. And because they are asymptomatic, they are more likely to spread it to the adults. Also, let's remember, schools are a place where a large number of children are in a concentrated space in a concentrated amount of time. So the risk of infection spreading is certainly there, which you are seeing in many European countries, which is being seen as a second wave. Hence, all of these aspects need to be considered in their entirety. And very clearly, the Indian Academy of Pediatrics has laid down guidelines when to open, depending upon epidemiological parameters as well as non-epidemiological. For example, the number of new, and this has to be taken like all of you
Okay.
mentioned, Mr. Gurumurthy mentioned, not only at a state level, but at a district level. And hence, the number of new cases of COVID-19 detected in the district should be decreasing in the preceding 2 weeks. The case positivity rate should be less than 5%, and the number of new cases has to be decreased steadily. It has to be less than 1 or 2 per lakh of population. This is the epidemiologic issue in that particular district. So that district administration, as you rightly mentioned, Afrida, micro management is the
Right.
key. At the same time, the schools have to keep the new norms of the infrastructure ready. The training of the staff has to be done. The hygiene facilities have to be looked at. The schools have to sort out their timetables, scatter the students in shifts. There should be a very good partnership between the school, the health department, and the parents. And the health administration should also be prepared for a second wave in terms of having the facilities for increased testing, for contact tracing, isolation, hospital beds. And the transport system, more importantly, should be functional. Because if you see in a place like Mumbai, there are so many children, and especially the teaching and the non-teaching staff, who may travel by the local trains to come there. And hence, it is very important not to be in a rush to do this. At the same time, when we are looking at the impact on the children, I think the biggest impact is the
Okay.
psychosocial impact on children, which we have to keep in mind. And given a chance later, I would like to address that.
Right. Okay, I think
Hello?
I got the larger points that Dr. Samir Dalwai is making here, and since he's somebody who deals with mental health in children very closely, highlighting those issues and those points is extremely important. Let's also have a perspective from the side of the parents here. Anubha Sahai, who is in fact president of the India-wide Parents Association. I want Anubha to come in on this to tell us, how much should we actually think about what the children want at this stage, because as a parent we all know, I have 2 kids myself and I know how it is for them to be cooped up in their childhood years for a prolonged period. But like Dr. Dalwai says, look at the risks out there, and we know WHO has released this important advisory where it talks about 3 C's, where if you have too many people in a confined space for prolonged exposure, that is a high risk situation, and that would be unavoidable in a classroom setup. Anubha? Anubha, can you unmute your audio? We are not able to hear you.
Yeah.
Could you unmute yourself first, please?
Can you hear me, Afrida?
Yeah, carry on.
Yeah, so right
Yes,
now,
I
Afrida,
can. Please carry on.
this is not the right time to open the school because we know what is the situation in our country, how is the medical infrastructure in our country, and nobody is ready to willing to take the responsibility if anything happens to even a single child. We know what has happened in JEE, NEET, and UPSC exams. So many children have been infected. Even some students have died also. You cannot say that children cannot be vulnerable and they cannot get infected. Even some students have died. We have protested against it, but still government did not listen. Now they are targeting small children. Small children, they are giving example of malnutrition. You are going to open school just for that malnutrition purpose or mental illness, whatever the reasons are being told are totally baseless. We can have a different kind of system. Already online classes are going on. We know that online classes are not that suitable for children, but still we can have lot of other activities which can be planned through TV channels, through a radio. Even our education minister a month back, he was also explaining that how we can reach out to students in remote areas where internet facility is not available. We have radio facility, we have television. There are so many other things through which we can get in touch with children and we can keep them engaged, just to show that yes, we can go ahead, life must go on, that's why we should open the school. So this is not the right time to open the school, and we know how the numbers are increasing in our country, and even most of the states are not doing proper testing. If we will do the proper testing in each and every state, the numbers will be, we don't know how much it will go up, maybe in crores. We don't have the proper data in our country that how much cases are increasing every day. There was in my area,
Right.
where I reside, eight people have died. 8 people have died because of this unlock. Initially, the virus was infecting. This pandemic was infecting. COVID was infecting people who were 40 plus, 40, 50 plus above people were getting infected with this virus. Then when they started opening up other activities, the young crowd like 30 plus, 30 to 20 plus children are also now people are also now getting infected. Now you are planning to open school. So definitely small children will get infected.
Okay, let me get Dr. Mahapatra to reflect on this point about the timing. I get your point, Anubha. You're giving us examples about how the vulnerability can be acute at this stage. But Dr. Mahapatra, is the issue then simply about the timing? Is it too soon? When, when would be the right time? When is the right time to open? Is that the critical decision that is to be taken here when it comes to reopening schools?
Definitely. And we have to be careful of the fact that not only opening of all these things, we are going to have this festive season coming up also. And different states are taking different planning regarding the management of the population and gathering and other stuff during the festive season. So what I think, managing one aspect at a time will be a better solution, because anyway, we have somehow decided to open the malls prior to the school.
Okay.
So, on the other hand, we actually need to understand that if we have waited so much, can we just wait for this festive season to go on? Because otherwise there is a chance of getting a message to the population that as schools are opening, everything is right now normal, we can have those festivals, everything, all the gathering, etc., as if everything has gone normal. So what I'll suggest that things should actually open up a little after this festive season, and by this time we should have our all infrastructure and disciplinary aspects getting into the system, because schools are where we get the discipline imbibed into the population, and our teachers need to be the the channel through which we can get this into the children's behavior, so we can plan according to that and should go ahead.
One quick word from Dr. Samir Dalwai, closing comment very quickly, because this is a tough balancing act, and we've already heard how the digital education is not an even playing field. And since you were weighing in, you said that we should err at the side of caution. I want to ask you that, among all the factors, what is your biggest concern? Is it school infrastructure, the safety precautions? What is your biggest concern for opening of schools at this stage?
The biggest concern is once school starts, parents will be constrained to send their children to school. And whatever we've discussed is bound to come true. The other thing to address is parents' worries about academics. The most important recommendation the Indian Academy of Pediatrics has made is the school and the education system need to understand that you need to readdress your curriculum for this year. You need to decrease your curriculum by 50% or whatever. There can be a discussion on that. But you cannot let parents continue to think that, look, at the end of the year, we are going to complete our curriculum. That is going to put parents and children under tremendous pressure.
So somewhere we have to cut corners.
The entire education
we have
system.
to, act prudent. Absolutely. Yes. We need to reorganize the education system to suit the new normal. That's the crux that I'm getting from what you're saying. But let's not forget, this is a country where only 15% students have access to digital education. So we cannot postpone this for too long, but yet we need those SOPs in place to make sure that this is a level playing field, that nobody gets dropped out of the entire system of education. There are issues of nutrition, a lot of children who get their midday meals in school. So all of these factors considered, this is a delicate balancing act, and individual state governments will have to do a thorough research of the ground realities before they come to a conclusive decision. I would like to thank all my guests for joining me here on Mirror Now this evening, and thanks to all our viewers for giving us your time.